Welcome to the Lancaster County Democrats Watchful Citizens Show. My name is Barbara Baier, and today's guest is Mark Intermill. He is Advocacy Director for AARP. Welcome, Mark. And today we're going to go and talk about health care reform. And we're going to talk a lot about the myths and facts of health care reform. Well, Mark, let's take a little time to get to know you.
Sure. Well, first of all, thanks for inviting me to be on the show. It's a great opportunity to talk about some of the things that we see at AARP and healthcare reform. I am from Lincoln. I've lived in Lincoln with my wife Nancy and our kids, who are gone now actually, but were raised here since 1990.
Wow.
We came from Topeka, Kansas. I was born in Nebraska, in Superior, Nebraska, but actually lived on the Kansas side of the border. As you know, South Superior is actually Kansas. So I was in that side of town. So, but we've been here since 1990 and have been involved in a number of activities related to trying to provide supportive services for older people.
Excellent, excellent. Well, healthcare reform is something I think that it involves all of us. It's just not older adults, but even young children, babies, young families. Could you tell us a little bit about the Obama administration's proposal?
There's what the Obama administration, or President Obama specifically, has done is he's laid out some basic concepts related to health care, and then he's asked Congress to try to develop legislation that meets those priorities. So what we are dealing with right now are several different proposals. The House of Representatives has a proposal on health care reform. The Senate Health, Education, Labor, and Pension Committee has developed a proposal, and we're awaiting the Finance Committee, their proposal on health care reform. Somehow over the next couple of months, we're going to try to merge all these proposals together and come up with some sort of a health care plan that provides affordable coverage, accessible coverage, doesn't discriminate on the basis of pre-existing conditions. These are some of the principles that I think that most people can agree on that we need to accomplish in the healthcare reform process.
Well, that sounds good, and that's probably one of the best descriptions of what's going on I've heard. Sometimes I get kind of confused by it all. Can you tell us, now I've heard that there's a public option. Sometimes it seems it's on the table, and other days it's not.
You never quite know where it is in relation to that table. But what the basic proposals that one of the basic proposals that's, I think, incorporated in all of the plans is something called a health insurance exchange, which is a place where if you don't have coverage, you can go to this marketplace called a health insurance exchange where insurance companies can offer coverage to you. That coverage is going to have to meet certain standards, things like that it has to cover you regardless of your pre-existing condition. There are going to be some limitations in terms of your out-of-pocket cost, co-payments and things of that nature, a number of other things that will make this affordable and accessible coverage. The public option is one of the options that some in Congress are proposing to include in that health insurance exchange or that marketplace. So along with an offering from Blue Cross Blue Shield or United Healthcare, there would be a public plan that would be available. And that has probably been one of the more controversial proposals, or parts of this proposal, is whether or not there should be a public option or not. At AARP, we have not taken a position on whether there should or should not be. And I can see healthcare reform working either way, with a public option or not, as long as we have those safeguards for consumers to make sure that they're getting value for the dollars they pay for coverage.
Now, we have some forms of publicly financed health care, and they're called Medicare and Medicaid. Can you tell us how that works in the mix of this?
Medicare, Medicaid, VA, TRICARE, all of those current public options would, at least, and this is where we have to be careful when we talk about a proposal, the House proposal, which is the most detailed proposal that's out there. In the terms of that bill, they would remain the same. There would be no changes. A person who is covered by Medicare would continue to be covered by Medicare. Medicaid would continue to operate. In the House bill, there would be an increase in the eligibility for Medicaid, or more people could be eligible. But basically those plans, as well as, for example, my employer coverage, would essentially stay the same as long as it meets certain standards. So I think the remarkable thing about healthcare reform is how little it changes. And I think that's an important thing to understand. For people who have coverage, it may not, you may not see a change as a result of this, but for those who don't, there would be options for those individuals to be able to get coverage.
Does AARP have any prediction on these reforms, on how many Americans would then be included in health care?
Well, we would like to see as many as possible covered.
Sure.
I think there are probably, in any type of proposal, and I think, and I guess I base this on what we've seen in Massachusetts, which has established a health insurance exchange with subsidies for those individuals who can't afford coverage. There are still people who are uninsured, and it's really hard to get everybody. I don't know that we'll ever get to 100%, but if we can cut into the proportion of people who don't have good health care coverage, it does have a benefit for all of us.